One of the big questions around COVID-19 is how immunity is determined without a vaccine. Back on April 23rd, the Prime Minister created a COVID-19 immunity task force, and University of Saskatchewan professor Carrie Bourassa was named to it. She is the Indigenous engagement lead, and she joins me now from Saskatoon. Thanks so much for giving us some time today.
Thanks for having me.
Now, first, you are a professor in community health and epidemiology. I wanted to get your thoughts on the outbreak situation in northern Saskatchewan.
Yeah, well, it is, I guess it's not a surprise, I would say. This is something that in our communities, we unfortunately were saying this was going to happen if appropriate precautions weren't taken into place. And if we weren't prepared for it, and it's something that it needs to be addressed, and unfortunately we're seeing a lot of our elders and even not only elders getting very sick, and in some cases some are dying.
What is the task force that you're working with trying to do when it comes to COVID-19?
So the serosurveillance study has really important implications for policy decisions. We need to know how many people have been exposed to the virus so that we understand some immunity level. And this helps us to understand the number of people that maybe had obvious symptoms, those that maybe were asymptomatic. If the number is high, then that gives us more latitude to sort of start easing off with some of the physical distancing measures that have constrained us, and the social our social lives and the economy. But it is really, I have to emphasize this, it's especially important for marginalized populations such as Indigenous peoples to be part of the serosurveillance studies, given that they might be more susceptible, as we just spoke about, for example, Indigenous peoples in the north, because they could be living with comorbidities. They may not have access to clean or safe drinking water. And being in the north, for example, they might not have access to healthcare, or what we would say even culturally safe healthcare. They might be living in substandard housing or crowded housing. How do you do physical and social distancing when you're living in substandard housing, and when you might have 10 people living in a very small home? So we have to give considerations to what we would call the social determinants of health. And for marginalized populations, not only Indigenous peoples, but Indigenous peoples is what I'm speaking about at the moment. These are very, very important considerations and are mitigating factors for Indigenous peoples, not only in the north, but if you think about in urban settings, thinking about shelters, people that are homeless, and again, overcrowding in homes that they may be in, and food safety is another big issue. So serosurveillance studies are very important so that we can understand how these factors affect different populations, and in this case, Indigenous populations.
You are the Indigenous engagement lead. In what way, if any, do Indigenous communities experience this pandemic differently?
Well, they are experiencing it very differently. I think we cannot underestimate, as I just said, the social determinants of health and the access to care. And we cannot forget, the impacts of colonization. And I know I hear a lot of people say, "Oh, colonization again. Aren't we over that?" Well, we're not over that, actually. First of all, we have, I think, to understand that colonization is still occurring. And while I think that we are certainly moving forward through the Truth and Reconciliation Commission, and people are learning a lot, we have to realize we still do have an Indian Act. We still do have colonial policy, and the historic trauma still lingers. And not only from years and years and years ago, but thinking about what happened with H1N1 and SARS, and the experimentations that did happen in residential school, we have to build a relationship with Indigenous communities so that they feel safe when vaccines for this pandemic from COVID-19 do come available, are they going to feel safe and comfortable? And even taking part in serosurveillance studies, this is a big step forward for Indigenous communities that want to be part of these studies, that are saying they need to be part of these studies, because there is a lot of mistrust when it comes to research and experimentation. And this is not experimentation, but I'm saying that because of what happened, there is still a lot of relationship building to be done. So this is a very, very big step forward.
Carrie, what should we be watching for in La Loche and other northern communities in the days ahead?
I think what we need is for Indigenous communities themselves to be leading what the next steps are and what they need and what kind of interventions are required. It is a very difficult for communities when other people come in and sort of think they have the answers. And I think that communities themselves have the answers. They understand, what they're living in day to day, and they certainly do have the answers. But we often don't ask them about what the solutions are. And I think that this is where that partnership, has to happen. And there are some best practices. David Chartrand in Manitoba, some of the funding that he negotiated nation to nation with the Prime Minister, I believe it was last year. They developed camps on the land-based, culturally safe, and that model I think can be followed, so that they're basically isolation camps for when in the north community, individuals or communities become infected, whether it be through this kind of pandemic or other kinds of infectious disease, then they can make sure that there's a safe place for them, that they have the right healthcare providers, whether it's through their nursing station, and then have an isolation period for folks, because as I said, there's many communities that they don't have the ability to physical distance, and then that's how it spreads very quickly. So I think there's some best practices that we can look at, and hopefully there'll be some funding available to be able to consider that. And that's I'm not even saying that to necessarily the serosurveillance studies, but sort of through the research funding that might be flowing out through the various tri-council agencies.
I know we're still very early days in this task force. There's a lot of questions, not as many answers, but what are your hopes for the immunity task force?
We are working really hard to ensure that Indigenous peoples are going to be representative, and we're already engaging with the working parties from the ground up. So input is being provided already in the groups on the population studies and the immunity science. There's also testing and cohorts, and so as I said in my interview on Sunday, we're developing effective mechanisms to ensure that advice and Indigenous issues, concerns, and engagement is provided on the task force leadership group on an ongoing basis. But for me, I think it's absolutely priority that Indigenous peoples are providing their feedback across these working groups. But it's a 2-year initiative. So for me, I believe that Indigenous peoples need to be leading many of these studies. We know that some of these studies are going to result in funding opportunities, and we need Indigenous peoples to be leading those funding opportunities. And I think a lot of these for Indigenous people, a lot of issues are going to be around socioeconomic and more holistic issues such as what about dealing with some of the grief and mental health issues in the communities, developing pandemic preparedness that is focused on Indigenous communities, which has been an ongoing issue. and really focusing on social determinants of health. I mean, if you look at the comorbidities and the lack of food security, the lack of clean water, and I think self-determination is front and center because, again, being the scientific director of the Institute of Indigenous Peoples Health for the past 3.5 years, we have focused on strengths-based resilience and self-determination. And I really, really would like to see that throughout the serosurveillance study as well. I think that's absolutely, if we want to see any success, that those are the key priorities.
Carrie, thanks so much for this.
Thank you very much. Thank you for having me.
Carrie Bourassa is a professor of community health and epidemiology at the U of S. She's also the Indigenous engagement lead for the National COVID-19 Immunity Task Force.